Is Dr. Kristin Englund, an infectious disease specialist with the Cleveland Clinic. Thank you so much for joining us. Dr. Englund, I have to just ask some of the things that I think a lot of people at home are wondering. There has been so much panic with this new variant, but even the World Health Organization has cautioned against overreacting with these travel bans. We're not seeing 1,000 cases or 15,000 cases of this like we did when Ebola broke out around the world, or even at the height of our own COVID pandemic at the very start of this. Is this a health alert, or are they sounding an alarm that's very preventative?
Good morning. Well, I think at this point in time, the World Health Organization is trying to get ahead of this virus to make sure that information is out there, but not necessarily sounding an alarm. This first case in South Africa was identified November 9th. It was reported to the World Health Organization just November 24th, so less than a week ago. But I think it's important to get the information out, that all countries be aware of it, but we're far from the need to panic at this point in time.
Even though we're seeing panic across financial markets, we saw that over the weekend. We're seeing all of these countries close their ability to receive passengers from South Africa, Botswana. There are a number of nations where travel bans have been put in place. But there have been no U.S. cases. And we know it could be weeks until we see how Omicron will respond to the current vaccines. So what do we know about this latest variant?
So what we know is that there are about 30 different mutations on this particular new variant, Omicron. So what that means is that there are certain parts of the spike protein, and we've all heard about the spike protein, that are different from the Delta variant. So what that means, we still don't know yet. Does that mean that it's going to make this new virus more easily transmittable? Does it mean that it's going to make it more deadly? Or cause more hospitalizations? Does it mean that it's going to allow people who have the vaccine to be able to be protected, or even those with natural immunity? Those are all the questions that scientists are looking at right now, as are some of the pharmaceutical companies as well, because they're looking to get ahead of this so that we can make sure that we keep everybody protected that chooses to get the vaccine.
Why do we keep seeing different variants of the virus? Is it mutating in the bodies of those who have not been vaccinated yet? You know, just that survival skill that viruses have to stay alive?
Oh, you're absolutely right. And that's what viruses do. They try to evade whatever systems we put out there to try and stop the virus. So as long as it's able to make copies of itself in people who have not been vaccinated, it's able to make more and more copies. And as it makes copies of itself, sometimes those copies are imperfect, so they're not an exact copy of the original virus. If it's allowed to continue to replicate in humans, it makes more and more mistakes and more mutations. Some of those mutations simply die off. Some of them are strong enough to continue and move forward. So as long as we have a lot of virus in this country and also around the world that continues to replicate, we're going to see more and more mutations. So what that means is we just need to learn more about each mutation to find out what that means.
Well, just really quickly, we're out of time, but Dr. Englund, we're still not certain as to how dangerous this latest mutation is, correct? We're still waiting to find that out.
Absolutely correct.
All right. Well, we'll hope that doctors move quickly to give us those answers, as I know they will. Everybody's watching. Thank you so much for joining us this morning.
Thank you.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.